presentation is Effect of Dark Chocolate on Subjective Mood and Cognitive Functions Among Medical Students, a randomized white chocolate control trial from Ms. Consil Yan.
Hello. Good afternoon to all. I'm Consil Yan from Manipal University College, Malaysia. I'll be presenting about a randomized control trial to assess the effects of dark chocolate on subjective mood and cognitive functions among undergraduate medical students. First of all, coca, as the main components of dark chocolate, contains an abundant number of flavonoids, especially catechin. It helps to improve vascular functions across the brain by vasodilation, which helps in greater cognitive functions. Apart from that, flavonoids in chocolate may interact with several mood-regulating neurotransmitter systems, such as serotonin and dopamine. Therefore, we decided to determine the effects of dark chocolate on subjective mood and cognitive functions among undergraduate medical students compared to white chocolate and no chocolate control group. We have conducted a randomized control trial from sample size of 60 students among 290 medical students of our college by proportive sampling. After considering various inclusion and exclusion criteria, these volunteers are further stratified according to gender and later randomized by stratified block randomization into blocks of the block size 3 into 3 groups, which are intervention, active control, and control. Students from the intervention will receive 36 grams of dark chocolate each day for 3 consecutive days, while for those from active control have to consume the same amount of white chocolate for 3 days. We also included no chocolate control group in the study. Throughout the 3 days, participants were required to keep a food diary to track their daily polyphenol intake and to reduce the amount of food containing high polyphenol, such as tea, coffee, and blueberries. The participants were requested not to have any other chocolate intake. Furthermore, daily questionnaire was distributed to record the possible side effects experienced by the participants. After 3 days, all the participants were required to assess their subjective mood using positive and negative affect schedule, as well as bond and ladder visual analog scale. Both of these are validated questionnaires to assess subjective mood. For cognitive functions, we assess in 2 domains, which are visual spatial working memory and reaction time. All data was collected and analyzed using EpiInfo version 7.2 using one-way ANOVA and chi-square. We also had to seek approval from Research Ethics Committee in order for the research to take place. Moving on to results, Table 1 explained the characteristics of study participants in terms of age, gender, and baseline polyphenol intake. None of these parameters are significant. While Table 2 shows the results of the characteristic. Table 2 shows the result of subjective mood assessment on day 3. As we can see from the p-value, there is no significant association between consumption of dark chocolate and subjective mood. However, it shows slight improvement in terms of mean and standard deviation, especially in positive effect and the containment effect, the containment aspect of the bond and ladder visual analog scale. For Table 3, which depicts the assessment of cognitive functions on day 3, has a similar outcome as of subjective mood, in which there is no significant difference between the results on cognitive functions in terms of visual spatial working memory and reaction time. However, dark chocolate is able to cause slight improvement on this parameter as well. Lastly, we also collected data on possible side effects after consuming dark chocolate, like palpitation, headache, constipation, and sleep disturbance as shown in Table 4. In short, dark chocolate shows positive significant impact on the sleep quality of the participants, since 31.6% of students in dark chocolate group had experienced sleep disturbance. The outcome involved subjective mood and cognitive functions were consistent with study conducted by Pace, MP et al. However, the research conducted by Phil DT et al. Shows improvement in both visual spatial working memory and reaction time. While for the side effect of sleep disturbance, our outcome was supported by a randomized control trial conducted by MJ Sherlock. In conclusion, it was shown that there is no significant association between dark chocolate consumption and cognitive functions, as well as subjective mood. In addition, it was shown that there is significant positive impact between dark chocolate and sleep disturbance. Hence, in order to obtain a consistent outcome, we would like to recommend to future researchers to extend the study period with larger sample size, as well as to use objective measurement tools like validated computerized tools to assess the parameters. With that, I'll end my presentation here. Thank you very much.
Now we have a question from on-site session first.
So thank you very much for your presentation. Just wondering about the limitation recommendation you just mentioned, that the sample size and also the duration of follow-up matters in this regard. So in future research, I'm just wondering what you would recommend for the duration of follow-up, or may include the dose of the chocolate and the outcome that you may measure, you may suggest to measure in the future research.
Thank you for the question. For recommendations for future researcher, it's better to include a larger sample size with the duration of probably can be more than 3 months or 6 months, because there is less research study done in previous literature conducting the research for longer duration as such. And for the assessment, because we measure for visual spatial working memory, so I will recommend to future researcher which they can measure the cognitive functions in terms of other aspects, such as the verbal memory and in terms of other memory, which can help in better overview of the effects of dark chocolate. Thank you.
Now, may I receive a question from online judges, please?
Thank you. I would like more elaboration on your rationale why you use reaction time as an indicator to indicate the cognitive function.
Thank you for the question. Because the reaction time is actually a direct implication or a direct judgment for how our brain works in short period of time. So if the dark chocolate is able to cause vasodilation in the brain, and it can cause immediate effects, especially in the immediate effects in terms of the immediate reaction time of the participants. So we believe that this is a better measurement tool or assessment tool to assess the cognitive functions.
I'm just curious, what do you think, how much of the influence of the psychomotor, like maybe the motor function that can be part of this reaction time?
For now, for the previous study, they also assessed for the reaction time, and mostly is due to mainly assessing the content of the dark chocolate, which are flavonoid, on the vasodilation aspect. So mainly it's through the blood vessels of the vasodilation, which increase the blood flow to the brain and cause increase in cognitive functions. For psychomotor action, I'm not sure. Maybe the future researcher can explore more on this aspect.
Thank you so much.
That's the end of your presentation. Thank you for such an interesting topic and practical all the way from Malaysia.